Our mission here at Alberta Health Services Telehealth is to provide services across the patient journey using innovative technologies that help improve healthcare and safety for the patient, for the provider, and for the health services. We provide it through the use of video conferencing technologies and unified communications technologies to deliver and connect patients with their providers.
Alberta is very geographically spread out, and so the challenge a lot of times is that travel distance to be able to come see their specialist. So hypothetically, you have a patient who could be living 9 hours away by car to come and see an orthopedic surgeon, hypothetically for a pre-op visit that could take 15 minutes or a follow-up consult. So to save them that 9 hours and thousands of dollars in travel, what we try to do is facilitate that. They still see the same physician and they still get the same care, but it's closer to home.
Telehealth is a very valuable tool that enhances the patient journey. So whether it's before they get here, so we know exactly what services they need, or when they go home, perhaps they need follow-up to reinforce messages or directions to their family doctor and so on. So it's an incredibly valuable tool.
Within Alberta Health Services, the scope of telehealth includes 1,400 endpoints in 125 communities that are supported by 130 staff. We have a core primary 3 sectors that Alberta Telehealth focuses on. That's clinical, admin, and education.
My colleagues and I have expertise in telehealth and have used it in a variety of areas. We realized what a tremendous tool that this could be for our own patient population and began using it more in the Pediatric chronic pain program. We use it both for individual sessions for very complex patients who live far away from the hospital or who find it difficult to come into the hospital. We also use it for class programs. It's a group program for young people who have complex pain problems.
I'm a respirologist, and what I do is I see different sorts of respiratory patients. So for instance, patients who have lung masses or pulmonary nodules, we're worried about cancer or TB. You want to see them in a timely manner, not just see them, but you need to see them quickly. And we've been able to develop here an urgent telehealth structure where we can see patients within 12 to 24 hours. And that's important so that you're not waiting a week to schedule telehealth.
My specific area of expertise and interest is heart failure. So that's our sickest class of patient. What we've learned in Canada in the past 2 decades is that you can't do justice to a heart failure patient in a usual office visit in 10 minutes to 30 minutes. What I look to telehealth for is, a way of connecting with the geographic displacement of centers. Patients are on incredibly complicated drugs, so we have a pharmacist who liaises with their own pharmacist. And finally, nurse practitioners or specialized nurses who are available 24/7. This is a team type of teleconference and not just a doctor talking to a patient.
Some of the initiatives we've done over the last approximately 5 years, we've set up through Alberta now our Acute telestroke program. So it's where we have set up 14 rural sites throughout Alberta, and we have a core group of physicians that are located at the 2 major urban centres, here in Edmonton and the one in Calgary. And we have stroke neurologists that take call, and through our telehealth system are able to connect with the emergency rooms in these 14 rural sites and assess the patients.
Within AHS, telehealth is ranked one of the top from a customer service perspective. And I can't say enough about the response that the positive response we've gotten back from patients.
I think telehealth really is the way of the future at several levels in clinical care, partly because of how young people are accessing technology more and more and are interested in technology increasingly.
Technology in telehealth is changing rapidly. We're moving from more of a predominantly room-based environment to a purely mobility or mobile environment. The telehealth of the future will be done anywhere, anytime, on any device.
I have a passion and a love for being able to deliver care to the families close to home. I feel that a lot of times, a lot of the care that patients need, it doesn't just come from the clinician, it's also coming from that family or community support.